You always want to stretch after your workout or exercise, not before. Now, this is very counterintuitive. You would think if you stretch before the exercise, you're going to reduce your risk of injury. But that's actually not true. You can actually increase your risk of injury if you stretch right before the workout. Why? Because most injuries occur when the muscle is in a lengthening phase, not a contracted phase. So static stretching does not prevent injuries. It can lower your performance. It can weaken your muscles. It can even decrease blood flow to the muscles. So the best thing to do is to stretch after the workout. That can actually increase your parasympathetic nervous system. So what should you do before the exercise? Well, a lot of top athletes do dynamic stretching. I'll put some links down below of what that looks like, but you're actually working the muscle as you're stretching it. It's just very, very unnatural for the muscle to stretch it without any type of contraction. The next thing that you should do, which is very, very good, is eccentric contractions. I did a video on this, very powerful. While you're contracting the muscle, while you're lengthening it, and then you pause, bring it up a little quicker, and then slowly, like maybe 3 to 4 seconds, you're bringing it down. And you can do this with any part of your body. But you can actually decrease the risk of injury when you do eccentric contractions. Especially the hamstring. You can actually decrease hamstring injuries by 50% if you do eccentric contractions. Also, you're training the muscle to control that stretch force. So the more control, less injury. You're also increasing range of motion and flexibility. And as a side note, you can actually do strength training to increase your range of motion and flexibility. It's pretty wild. Now, I want you to do an experiment, okay? And then come back to this video and post what you observed, okay? So this week, I want you to take one of the workouts that you normally do and stretch before the workout, and then the next day with stretch after the workout. And I want you to observe the performance, the endurance of that exercise, your flexibility, how far you're able to touch your toes or your general range of motion, and just compare these two things and then comment down below. You're going to find that if you stretch after the workout, your flexibility, your range of motion is going to be much, much better. Hey, before you leave, I just wanted to give you a little quick history on some of the books that I wrote. This was one of the first books. It's called Dr. Berg Body Shapes. It was my attempt at writing about body types. What was very interesting about this book is I actually did all the images myself. Don't ask me why. They look actually not quite as professional as some of the images that I have in the new book. But anyway, this is my first attempt right here called Dr. Berg's Body Shape Diets. And then I wrote a book more extensive called The 7 Principles of Fat Burning. I don't even have a copy anymore, actually, because it's outdated. The next book, I put about 1,000 hours into this one right here called The New Body Type Guide. Major updates on the body types. I put a lot of energy into this. It has professional images, graphics, all sorts of things. Now, the problem with this book is it doesn't really describe what this is really about. Body types are only a small portion of what's in this book. And that's why I changed the name to the Healthy Keto Plan, okay? If you happen to have this book, you don't really need this book because there's some only very, very minor updates. But if you don't have this, you need to get this one right here. This book goes into every single detail that you would ever want to know about. It goes into the 7 principles of fat burning. It goes into hormones, the body types, the basic keto plan. It goes into intermittent fasting. I talk about the 10 fat burning triggers and blockers and fat burning strategies with a lot of details in every single chapter. I go into body issues that interfere with losing weight. There's very few people that just have a weight problem. They have a lot of body issues, whether it's sleeping problems, stress problems, inflammation, menopause. I cover that extensively in this book. Then I talk about how to get rid of stress, and I show you a technique. Then I get into exercising. And then I have a lot of really good recipes in this book as well. So this is a good reference guide. On my website, if you get this book, you get this one free. It's called Healthy Keto and Intermittent Fasting. This is the shortcut, quick guide to this book. And the reason I created this book is to have you within 45 minutes, learn how to do keto, okay, in intermittent fasting, exactly what you need to do. Then you can fill in the blanks with this book right here. So right now I'm doing a special. If you get this book, you get this one totally free, or you can go to Amazon and get these individually. So I just want to clarify the difference between this book and this updated one right here. If you don't have this, you need to get this right here. That way you can get the exact correct information to do it healthily.